Hello, welcome to BMC. Today we are going to react to the Yukon vet. So join me, you'll learn something. Dr. Michelle Oakley was born in Indiana in 1969, and she graduated from the University of Michigan with a degree in zoology before she went to PEI to attend the Atlantic Veterinary College. She graduated as a doctor of veterinary medicine in 2002. After graduation, she worked for the Yukon government as a wildlife veterinarian, and she spent a bit of time in Calgary at the zoo doing a bit of an internship there. Dr. Oakley joined Nat Geo and is the star of the show Yukon Vet. It first aired in 2014. Dr. Oakley is also currently active in wildlife conservation, and her veterinary clinic operates out of her house in Haines, Yukon. So let's watch some snippets of some of her episodes. Vet to all things is what this segment is called. Let's check it out.
There you go.
Ooh, reindeer.
You got away with animals, Michelle.
I hope so. It's important in my line of work.
I'll say.
Most vets pick a specialty, or at least start to specialize into a certain type of veterinary medicine. That's just not an option up here. I see everything from bison to parrot.
What she's saying is true. There's just so much to know, and with the level of care that is expected by most people for their pets, it really means that we have had to start to narrow our focus a bit. When you are somewhere rural, you are the only option, so it's you or nobody. And that does mean that there's some limitations to treatment options, but at the very least, providing pain control, ensuring a decent quality of life, and providing peaceful euthanasia when quality of life is suffering, those are huge and very incredibly helpful. All right, let's keep going.
I don't like bison to parrots. We gotta have some alliteration there. Bison to bulldogs, caribou to cockatiels, muskox to
It's
mice.
angry.
Basically all creatures wild and woolly. Sorry, beauty.
Yeah, when you have a lot of wild or semi-wild animals that can be very dangerous, often the kindest way to treat them is to sedate them with a dart. And then once they are sedated and unconscious, then you can safely examine them and start a treatment plan.
Creature is great and small, and I gotta do them all. Perfect. The animals that are up here and they're surviving out here, they have to be tough. They have to deal with the cold, with the wind. It can be 40 below for a couple weeks at a time.
Oh, there's that
Winter.
sedated.
Are you excited?
Yeah.
Which one are you most excited about?
Cheetahs.
The cheetahs,
Ooh.
yeah.
Why are there cheetahs in the
Of course,
Yukon?
it's exciting to work with muskox and bison and moose and lynx. That's really interesting, and it's great to get to see these animals close up. Hey, girl. So
Smart.
wildlife rehabilitation
Very
is,
smart.
It can be really.
Check that your sedation dosages were successful, because of course you are estimating weight and you want to be sure that they actually are really sedated before you get yourself too close. And putting towel over the eyes and ears can reduce the stimulation that the animal is receiving from the environment. That can help the sedation to be more effective, keep everybody a bit more safe.
Really difficult and challenging and sad in some cases. I'm here to do a recheck on the cheetahs because about a month ago, one of them had a chicken bone that actually.
This is why I keep telling you, do not feed bones to your pets. Do not do it. Don't do it.
Stomach.
Ugh.
And it had to have emergency surgery.
Oh.
Hey, Annie. This is my daughter, Sierra. Please don't eat her. You have to be aware of your surroundings here as well. I mean, you're not the only species on the trail here, right? The bottom teeth are really cool with all the little.
Oh, whoa, look at that. I've never seen these teeth before.
Some adaptations on them.
Yeah.
Some of those have, dangers to you as an individual, and some don't. It's, trying not to disturb them is the big thing.
Yeah.
Buddy?
Do you
Keep
remember
things
which
as
side
low
of his
stress
chest
as
was?
possible.
It was his left lung.
His left. Okay. You got to be quick
Cute
around
bear.
bears. I mean, even well-trained bears, because they're bears.
Yeah.
It is a big role to be a vet here in the Yukon and Alaska in these remote areas.
I imagine that she's on call 24/7 and never gets a break. I'm guessing a very difficult, demanding occupation for her to be the only option, you know, in such a vast area. Ooh, he's mad.
You have to be really careful when you're working with the muskox.
Yeah.
Because they, you know, they will get you. No, he's coming. He's coming. So, you know, you have to safely get in, get them darted before they get you, I guess, is the plan.
She seems really lovely and very, you know, common sense and quality of life focused, and I really appreciate seeing that. Now we'll check out a segment where she sees a specific patient. What a beautiful area.
Good boy.
Hi, Shuri.
Hi, Dr. Oakley.
Hi, Skittles. How are you? You're limping.
Yeah.
What happened with Skittles?
I don't know.
Oh, okay.
I came here today
I love that his name is Skittles, but he's definitely got pain. It looks
because my dog Skittles, who's almost 12, just seemed to start having some hip issues. And when he went to jump in the truck, he didn't make it. Since then, he
she's so worried about her dog.
can't even keep his balance, really.
Is it the right one?
Yeah.
Yeah, his right hind. Okay, I thought I saw it just when he stood up. We'll kind of move him around a little bit. Dear, can you walk him towards me? Skittles!
Yeah.
Come on. Skittles grew up here in Haines. It's bear country. 2 days ago, he ran 2 bears off of me on the Chilkoot.
What a good dog, keeping his person safe.
Without my dog, I believe I would have probably been tasted at the least. Come on. So he's my bear dog, and I need him.
He's definitely sore on that right hind, and it looks like both front legs too. He's holding his elbows out. He seems like he's got a lot of pain in multiple joints.
A little bit kind of wonky. He also looks a little sore to me in his front elbows, both of them at different times. I can do some feels, but I might want to also take a quick x-ray if that's okay with you, so we can figure it out. Okay.
Oh, and there's surprise cats.
And then you also have 2 kitties I see for me.
I do.
I haven't met these kitties, have I?
You haven't. Maynard
Yeah.
and Naked.
I love the names that this person gives their pets, or the family that this person belongs to. Skittles, Maynard, and Naked. What a crew.
Maynard and Naked.
Yeah, they are brothers. And they're just over a year old.
And so why is this little kitty named Naked?
Good question.
Well, it was actually my daughter's cat, but she loves the fact that she can scream, "I'm gonna go get naked."
Oh, wonder how old this daughter is.
And that's how we ended up with a naked cat.
Oh, this person's so good-natured about this. I love it so much.
It's pretty awesome.
Yeah, we have fun with it.
Yeah.
Sounds like it. And what's going on with these guys?
Maynard needs shots and checkup.
Okay.
Naked has a pre-existing condition.
That was the heart issue, right?
Yes.
All right, we'll take
fair
the
enough.
creatures in and, ooh, they're heavy. Come on. Oof.
My biggest fear is that my bear dog is gonna be retired.
You can see how attached she is to this dog. Makes me think about when my Labrador is gonna be getting up to that age. Ugh, I can see how much she loves this dog and how hard this is on her.
Permanently and not able to just, go out even to be out.
There he is. Skittles, how are ya?
Oh.
What I hope will happen is nothing serious.
Oh, I'm feeling this human's emotions because she's so upset about this. Look at the drool off of Skittles. I wonder if they were offering him some sort of food reward to sit there so that they could get a good shot for the camera. 'Cause look at what a good boy. You can also see on his eyes in the pupil that he has some, looks to be lenticular sclerosis, which is an aging change. This fellow is definitely a senior. He seems very sweet and good-natured.
Alrighty, we're gonna get a couple x-rays of his elbows and knees. So for Skittles, there's a couple different things that can be going on. I mean, a dog can have arthritis wherever there's pressure in the joint. They also have like a flat little ligament that cushions both the bones.
Is she talking about cartilage, like the meniscus on the knee maybe? Or is she talking about the cruciate ligament? Hopefully she explains.
You can get a tear in that little meniscus.
Oh, in the meniscus,
so,
okay.
Since I'm not seeing anything obvious in the gait, it's best for me now to do an x-ray.
That made you so nervous. I'm so sorry.
Poor guy. So this is why I have said before that sedation for x-rays is key. It gets you much better views. It's much less stressful for the patient, even if it's just some oral medication that helps them to be a bit more relaxed, because he's nervous and he's going to be tense. And if you're trying to manipulate painful joints, in some animals that can make them become fearfully aggressive or react in an aggressive manner because they're that painful. So when you use sedation, you get better views, more likely the correct diagnosis, and it's safer for the patient, for the people, everybody.
You just hold tight. Let's see if we can spread these elbows.
Oh, he's so stressed out. Look at, poor guy.
With an x-ray, I can actually look at both the upper bone, the femur, and the tibia, and even the patella, which all make up the knee joint. Okay, back up a bit. But I can also see if the knee joint itself is kind of swollen. Like, I'll actually see if it's expanded with fluid. I'm gonna come have a peek. You stay with them, okay? See what I got so far. That looks great, and there's definitely some arthritis there.
Yeah. You can see the osteophytes, which are a classic sign of arthritis. These x-rays from this screen, in this view anyway, I can't tell enough to see about the cruciate ligaments or to see if there's swelling in the joint. There's definitely arthritis changes here.
When dogs have arthritis, sometimes they'll get up really obviously stiff, and then they'll sort of work through it as they kind of warm up and move around. Good boy.
So here she's trying to check for the cruciate ligament to see if it's intact. When they are conscious and painful, it's very difficult to do this. You need them to be relaxed in order to check. We call this the drawer sign. She won't be able to properly assess this in this worried of a painful dog who is not sedated.
Try to put his leg through motion. No swelling.
Okay, so she didn't even really try for the drawer sign, or at least not with what they showed here.
I'm gonna send him home with some anti-inflammatories that can
idea.
help with that little bit of arthritis that I see. He's actually in awesome shape, like, and yeah, he's got a little bit of a limp, but he's got, you know, he just seems like he's got so much life left in him. So it's just gonna be rest and some anti-inflammatories to keep him quiet.
He absolutely needs anti-inflammatories. That is the first line pain management for arthritis and for many painful conditions. Thankfully, he already is a lean body condition score, which is great to see. But I would also be talking with the person about more cushioned bedding, because you can see he has the sores on his elbows, and that may help him to rest more comfortably and be less stiff when he initially gets up. He also may need additional pain management added into those anti-inflammatories. Things like gabapentin are commonly used, or there are injections like Adequan. There's just a lot more than anti-inflammatories that could be done to manage this dog's pain. Obviously, I don't know what they all discussed off camera. He's so sweet. Oh, good boy. Oh, okay. And that's the end, apparently. They didn't show anything about the cats. They seemed a little fearful though, so maybe not having the cameras there was the best choice for the cats. From the superficial dive I did into Dr. Oakley here, I'm pleased to say that this does seem to be reasonable research-based medicine, and it does appear like Dr. Oakley is likely a lovely human being doing their best in a rural environment where you do have a lot of constrictions placed on the type of medicine that you're able to do because of where you're located and the tools you have access to. I'll probably watch some more of the Yukon vet just to see, you know, what other species she might treat or other neat situations that might arise. Although maybe they're not so neat when you're the one living them, especially if it's the middle of winter and you're called out in the middle of the night, you know, less neat. I did enjoy this. You know, is this gold standard top tier medicine? Apparently not quite from what I saw. However, is there anything completely contraindicated or wrong or dangerous that she's said, no, you know, this seems to be great, and I'm sure that her clients are very grateful to have access to her, as Dr. Oakley is appearing to do the best that she can with the tools that she has and in the location that she's in. This was a really lovely and pleasant surprise.
Oh, you've woken up from your nap. Are you ready for me to be done? Okay, we can be done.